we are getting rid of our equipment after we've made contact with the patient and we don't want to contaminate anyone else. We need to take care of being cautious that we don't do this in a wrong way and contaminate ourselves. So we take our gloves off first. And all the stuff that we remove goes into a biohazard safe bag. Once we take our gloves off, we're going to do hand sanitizing. And once we've cleaned our hands, what we're going to do is we want to take our gown off. So we pulled it back, making sure that we don't want to do any sudden movements and causing anything that's on the surface of the gown to be sprayed. Back into the biohazard bin. More hand hygiene. Then we'll remove the visor, closing our eyes as we do so in case there's any droplets that are on it. And then as we remove our mask, we're going to hold our breath and breathe out as we do it and keep our eyes closed. That way any contaminants that are on the surface of the mask aren't going to be transferred to our eyes or our face as we breathe in. And then finally, as is the common theme, hand sanitizing.